This is a
Recording in progress.
yeah. Thank you. Recording is in progress. Thanks everybody for coming to this wonderful presentation by Dr. Melissa Lewis. This is part of our series uh, funded through the CDTR, HIDR, INIH funded um, kind of a network of researchers around the topic of diabetes. Um, and we are very happy to have Dr. Lewis presenting to us. Dr. Lewis is an associate professor of family community medicine at University of Missouri School of Medicine, and she is also a citizen of the Cherokee Nation. Her research includes preparing healthcare professionals to work with indigenous populations effectively, examining the role of stress and trauma, as well as cultural practices on cardiovascular diseases in the indigenous population, and co-creating and evaluating interventions aimed to empower indigenous families and communities by privileging indigenous knowledge and practices. Programs include Cherokee community building through reconnection with culture, history, land, and language. Her research contributes to the body of work that demonstrate the indigenous culture relate to improved health and well-being. And with that introduction, welcome, Dr. Lewis, and thank you. Floor is yours.
Well, thank you so much for the warm introduction and very good to see you.
Same here.
Yes, I had a little bit of trouble too. I had to go to my other folder to find the Zoom. So hopefully other people know to go there as well. Let me share my screen to get started. Let's see. Okay, can everyone see my screen all right? Okay, well, again, thank you for having me here today. I am going to talk a little bit about the research that I do, my research portfolio, which involves the relationship between Indigenous culture and health and well-being. I did want to share that I appreciate the support um, in our department to be able to have statistical analysis support from Jamie Smith, and as also part of the research team is Ivy Blackmore, and I appreciate their support and all the support, all the admin support that has made these research projects possible. I also wanted to share Indigenous Peoples Land and Water Acknowledgement. I won't read the whole acknowledgement, but did want to share that this was created by a president of a student group called Four Directions at University of Missouri, which was really eloquently written and described a little bit about the ancestral people to what is now Missouri. And there's sort of four main points, and some of you might have seen this before, so bear with me. But really, the four main points of uh, this presentation and the majority of the research that I do is this. One, that Indigenous health and well-being is holistic, that colonization and ongoing discrimination, as well as racism, has degraded the health status of Indigenous people, but culture and the act of cultural revitalization and decolonization relate to positive health status. Four, traditional cultural practices are preventative and sometimes treatment for physical and mental health risks that Indigenous people experience. So just a quick background before we sort of get to the interventions. Some of you may have seen this diagram from the National Center for Health Statistics that came out a couple of years ago. Um, starting with dark blue to light to green, we have life expectancy in years, and for all groups, it has decreased in those 3-year periods. We knew the effect of the pandemic being one of them. But if you look at the category to your right, American Indian, Alaska Native, the life expectancy is the lowest at 65 years old. A very quick overview of the state of Indigenous mental health. Indigenous people experience serious psychological distress more than general population. They experience post-traumatic stress disorder twice as often as the general population, and suicide is the leading cause of death among American Indian and Alaska Natives aged 10 to 34, which is 1.6 times higher than the general population. Also, Indigenous children and adolescents have the highest rate of depression compared to other groups. We already discussed life expectancy a little bit, which is related to the highest mortality rate in the United States of any other racial and ethnic group. The prevalence of type 2 diabetes is 17.3% higher than other groups. And when we look at cardiometabolic disease, including cardiovascular disease, type 2 diabetes, and the rate for stroke, Indigenous people experience these cardiometabolic diseases at 2 to up to 3 times higher compared to non-Indigenous groups. As far as information we have on people that live where I'm currently at in Tahlequah, Oklahoma, which is the capital of Cherokee Nation, we have public health department that has done reporting a little bit over 10 years ago. And they found that heart disease is the #1 killer of Cherokees in all age groups, starting with 30 years old and up. They also did a really interesting, I think, analysis looking at, compared to non-Indigenous people, what are the amount of years of potential life lost? And so they found that heart disease deaths total 3,754 years of potential life lost each year for Cherokee people. That's kind of a mouthful, but this is a statistic that I think about often and I go back to often. Not only are we in a public health crisis in regards to physical health and to emotional and mental health, but also our culture and language is kind of in a parallel state of crisis. And so when I think about these Cherokee people who are dying at younger ages than our peers in the United States, for example, I think about the people that are there to teach things to the younger generations, those that teach Cherokee language, those that teach Cherokee culture, teach Cherokee crafts. They are not able to be there with their grandchildren to teach them those things. I wanted to share a little bit about a literature review that our team did a few years back, where we wanted to investigate what is the relationship between Indigenous stress experience, mental health distress, and cardiometabolic disease. And the literature demonstrated that there was a relationship between these 3 areas, and that there was a higher rate of historical loss and trauma, early childhood stress, and adulthood stress, which is like racism and discrimination for Indigenous communities. And people tended to point to the experience of colonization that resulted in these higher rates of Indigenous specific stressors. The literature shared that this stress related to mental health distress, both psychologically and physiologically, and with increased mental distress came cardiometabolic disease risk factors, increased incidence, and increased mortality. If you look at the very bottom, there's kind of an additional component. So not only did the literature show that stress, really Indigenous specific stressors, were on the pathway to increased cardiometabolic disease, which is sort of like, I see it kind of like as additive, kind of adding to this increased risk, but also colonization subtracted something that was part of Indigenous people's life ways. So That's that disruption of traditional life ways. And that in this model happens through reduced protective factors. And those protective factors are things like traditional life ways, hunting, fishing, foraging, traditional cultural practices, social networks, and use of traditional medicines to treat some of these diseases, for example. And just kind of honing in a little bit on the relationship between colonization and mental health that was in that particular diagram. Looking at the literature that exists, historical trauma, for example. One piece of literature demonstrated that participation in forced colonial assimilation programs, and in this case, this is boarding schools in Canada, related to worsened physical and mental health status, such as anxiety, depression, PTSD, and alcohol and drug abuse. And that was compared to other Indigenous individuals that did not go to forced colonial assimilation programs. As far as discrimination, each unit of increase in an experience of discrimination predicted a twofold increase in likelihood of depression. Similar dose response relationship with microaggression experience through stress accumulation led to increased rates of depression. So the flip side of the coin, which I alluded to a little bit in our diagram, is the experience and the participation of traditional and cultural activities. And this body of research is growing daily. And so in this body of research, people look for the relationship between Indigenous people and those that identify strongly and positively with their identity and or take part in traditional cultural activities and life ways. And looking both at youth and adults, there have been improvements in academic performance, mental health, reduced substance use, and improved physical health. And these examples, smoking, obesity, and diabetes. So culture and cultural life ways are hard to define and really messy to try to analyze. So I kind of want to start out with this definition by United Nations. Indigenous people have, over the course of generations, developed rich sets of knowledge about the natural world, health, technologies, and techniques, rites and rituals, and other cultural expressions. Culture is one of the 6 mandated areas of the Permanent Forum and is linked to Indigenous peoples' identity, traditional knowledge, experiences with the natural environment, and hence their territorial and cultural rights. So these life ways are, I guess I would say, the sovereign rights of Indigenous people to practice and have been practiced for thousands of years. So for example, people talk about Indigenous languages, and life ways are linked to the history of their time in a particular location. It's very hard to piece out which part of culture does some particular thing for an Indigenous community. I will talk about how I've attempted to parse them out and put them back together in just a moment. So this issue of measuring culture using quantitative or even qualitative methods has come up quite a bit. So much so that we are now in a team of, I think it's been up to about 20 people working on a systematic review. We wanted to learn how have people measured Indigenous culture over the last 2 decades or so, and what their results have been. So we're working on a systematic review. We're actually in year 2. We started with 9,000 articles. And some things that we are doing right now, we're down to about 300 articles. What we're trying to do is just extract that information. And something that might just be interesting to know is we're trying to look at the domains of culture and then how people have operationalized it. So domain would be like language, foods, medicine, traditional games. And then for each particular domain, we're looking at how did that measure operationalize it. So For language, how well do you know traditional Indigenous language, this particular traditional Indigenous language? What are your skills using that language? What are your beliefs about that language? How satisfied are you with it, and how connected do you feel to it? So we are in the midst of really trying to hone in on how people have measured, and what are the results of measuring culture. In my particular research portfolio, there are 5 main areas that we're taking a look at. And this is kind of a funny Venn diagram, and that just represents how they are really tied to one another. And so we know they are tied to one another, yet we are also trying to measure them separately and together. So the ones that we are looking at currently are the effects of learning language on health and well-being, the effects of learning about traditional foods on health and well-being, learning about our Cherokee history on our health and well-being, learning about our natural ecology, our traditional Cherokee ecological knowledge, and then also learning about the history of our community and making goals to have strong community connections. So in very, very brief, I know there's a lot going on here, but there are 4 different programs, and each of them have a cultural focus area in blue, yet they all encompass almost all of the other areas as well. Kind of going back to that systematic review, like what exactly are we measuring? So the very first project is called Remember the Removal, and in brief, this is a project for young Cherokee adults in which they learn primarily Cherokee history, focusing on the removal era, and at the very end of the intervention, go on a almost 2,000-mile bike ride where they physically go to historical places they've been learning about. There are also components of cultural learning and language learning in that program. The second program is Little Cherokee Seeds. This is an ongoing project. In this project, the goal is to create first language speakers of the Cherokee language, and to do so, there are mothers and children that come and meet every day, 5 days a week throughout the year, hearing the Cherokee language from first language speakers. But again, there's food components. They have their own traditional heirloom garden. There are cultural components. There are ecological components, and certainly community components. The third program is called TSEC, Camp Traditional Cherokee Ecological Knowledge. That is for junior and high school age children, where they learn about ecological knowledge passed down by Cherokee people. That's what do we know about our traditional stories, about birds, about waterways, about how to take care of the earth, that sort of thing. That's also ongoing. And the fourth one is called Duyukta Ikaleni Santi. So this particular program, like the other ones, was put together over at least a year's time of meeting with a community advisory board. They were very inspired about the results of their Remember the Removal program and wanted to focus on learning about the next era in our history, was the allotment era. After Cherokees were removed from the Southeast United States, then came an era called the allotment era, in which Cherokees were forced to live a particular way in a single family home, a nuclear home, placing men as the head of the household. And all of that was very contrary to how Cherokees had previously lived. We are a matrilineal society. They made men go into gardens, and that had never happened in the history of Cherokees. Women were in charge of gardens. Again, they made men the head of households, which wasn't the case. We had multi-generational families, and they placed Cherokees in nuclear families as they allotted a certain amount of land to each community. So it became very important for the Community Advisory Board members to expand the Remember the Removal program, but really focus on this time of history that changed a lot of our social norms and our gender norms. And so in this program, I'll talk about it a little bit more in just a moment. But we worked with each community to learn their history, look back, to look forward, and to build goals for their community. So with that kind of brief overview of those programs that are cultural interventions, and with each of them having a little bit different focus, history, language, ecology, and community, it's been really exciting to see the results. If you look at the results section, the top two in each one of those is an increase in Cherokee identity, values, and connection. And the second category is mental health, which is primarily measured through, it's called the KEYS continuum. It's a positive mental health measure. And it's inversely related to depression and anxiety. And something that's important with the research that our team does is that we work to reduce pathologizing Indigenous people. We work to reduce asking them about their traumas and their stresses. And so the positive mental health scale or continuum is an instrument that we use, that we have learned to use, that asks about your mental health. Is it flourishing? Are you happy with your life? Are you connected to people around you? Do you see the world positively? So we don't have to continue to ask Native people, how depressed do you feel? Which that is kind of re-traumatizing for Native people. So again, what's been exciting about this sort of entire portfolio is that we are seeing increased connection to identity. We are seeing increased improvement in mental health, and we are seeing some other things here and there. For the RTR, looking at diet, for example, they had reduced sugary beverages. In our Diyukta Ikalani D program, we did see, it says positive in weight, but that's referring to a positive result. We saw statistically significant reduced weight. And that program just finished a couple months ago, so that data is all preliminary right now. So just kind of diving in a little bit to some of these categories. There was a systematic review done in 2016, and they were looking at traditional Indigenous language use and health. What they found was that for mental health, those that had more fluent communities had youth suicide rate. In the socio-ecological domains, they found that fluent speakers had reduced health risk factors, less excessive alcohol consumption, illicit drug use, and violent victimization. And the case study of Hawaii was really interesting when looking at language immersion schools compared to high schools who were not language immersion schools. They had a higher graduation rate for Native Hawaiians who were in immersion schools. Looking at physical health, they found that there were less smokers in fluent communities, had higher wellness categories, and lower rates of diabetes. So this was a systematic review that happened in 2016. And the authors of this particular study wanted to redo this, the systematic review, because a lot more data had come out since then. This was a really important research project to demonstrate these relationships that people hadn't considered before in the Western world. I guess I will share that in Indigenous, the research that's being done is being done sort of as a tool. In Indigenous communities, people continue to see the importance of passing down culture and language, and quantitative research is sort of a tool to support Indigenous communities' beliefs and their lifeways. So I was invited to be part of the team in which we did another systematic, but using a realist review methodology in 2022. And there were more articles, If you look at blue, that means that there was a positive outcome in that category, and the categories are there on the bottom. A red is neutral, and green is negative. So for almost all categories, except for tobacco being one of them, the use of an indigenous language was associated with a positive outcome. There were some interesting caveats. So education and tobacco, for instance. So they were asking second language learners to complete tests in a language they were less familiar with. And so that is sort of why we see the high rates of negative educational outcomes in the education category. And as far as tobacco, excuse me, when Native people are asked, when Native people are asked about tobacco use, it may be for ceremonial purposes, and ceremonial purposes may or may not, but are less likely to involve the use of smoking tobacco instead of using it for religious purposes. And so what we found was in the category of tobacco, they did not use a survey in which they asked that caveat. Usually best practices are, do you use tobacco generally, and then what percentage of your tobacco use is for ceremonial purposes, and that is usually deducted out. So that wasn't the case in some of these studies. So this was it was really important to see the results of this study. It kind of helped bring more evidence, both for sort of a public health lens into incorporating Indigenous languages into their portfolio of interventions, but also to strengthen, language departments, and knowing that Indigenous language has a positive holistic effect on Indigenous children. So in addition to language, Indigenous foods have been found to be related to improved health and well-being of Indigenous people. And I think there's a variety of reasons, and I highlighted a few here. Indigenous foods are much more highly nutritious than contemporary foods, and there's a lot of really fun, interesting data about that. I don't have time to present today, but there's data that compares, the indigenous food to what would be on in the grocery stores today. And you look at the micronutrients, and it's just amazing. The variety, so I think they say that Americans have less than 30 different foods on average throughout the year, and an indigenous diet has over 300. So again, the variety, the additional micronutrients, nutrients, etc. Other components of indigenous foodways are seasonality, providing foods during the seasons our bodies might need them. The exercise that's involved in preparing and finding and getting these foods ready for cooking. Indigenous foodways have an inherent aspect of community and social support. It's time to gather corn, and just does not make a lot of sense to gather corn with one person when you have 30 people to help. There's the ecology and sustainability of Indigenous foodways. There's components of spirituality and language. So in one particular study I wanted to share by Dr. Norgard, in this text, they looked at a Northwestern tribe who really depends on salmon in their diet. And they looked at the amount of salmon in the 1950s and the rates of diabetes in the 1950s, and they compared that across time, and there is a pretty clear inverse relationship. So I think our foodways are very essential in thinking about cardiometabolic disease. Here's just again a quick high-level literature review of research that's been done in different regions across the United States. Many of them are a while ago. The number of participants are available for each site, the length of time from being up, up to a year down to 3 days. But really looking at those cardiometabolic disease risk factors like calories, weight, blood pressure, cholesterol, blood sugar, um, even MRI, hepatic fat fraction, as well as depression and chronic pain. These research projects have shown that people within those indigenous communities who've participated in a traditional indigenous food diet from their region had improved or reduced, I should say, uh, cardiometabolic disease risk factors. And maybe just another note, again, even though each of these focuses on food, you can see other aspects of culture involved. Many of them, people are learning the language of their traditional foods. Again, there's community aspects of preparing these foods, which are very multidimensional. Okay, I think I have some time. I wanted to share some of the programs that I direct um, that I really enjoy, that they've been a lot of fun to put together. Many of them started with a community advisory board where we thought about really in depth, what do we want Cherokee youth to learn? What do they need to know? And from that, we came up with this curriculum. And many people in our advisory board said, what we really want Cherokee youth to know is that we want them to be reconnected to what's all around them. And so that has resulted in a 10-day nature camp. It says 12 to 19-year-olds, but we've had as young as 7. It takes place just south of Tahlequah at a place called Camp 7 Star. It's 260 acres of core land, and this is through a nonprofit called the American Indian Resource Center, who has been led by Cherokee women for over 40 years. So a very strong group here at Cherokee Nation. We had presenters come and talk about some topics I'll share in just a moment, and 80% were Indigenous, and 66% of those were Cherokee. Oh, I forgot, I gotta share, this is a little bit of what Camp 7 Star looks like. It is ripe with flora and fauna, and we also have some heirloom gardens, medicine gardens, and pollinator gardens. So each day had a different topic, plant relatives, heirloom crops, trees, insects, amphibians, birds, animals, and the last one, relational knowledge, which in the Cherokee language, the word skadugi means everyone together. So how is it all connected? Every single day we start with an icebreaker, then we have a traditional Cherokee story about each topic. And these stories were meticulously selected. Again, this all started with, what do we want for our Cherokee children? We want them to have this knowledge, and we want them to be empowered. We want them to reconnect with what their ancestors knew and think about themselves as scientists, just as their ancestors were scientists. So every story, every day, has something to do with a topic, but a theme in traditional Cherokee stories is about the smallest thing making the biggest difference. And so that's a theme in the stories that they hear. And in our very first year, we're now in year 2, but in our very first year, what was exciting was to see the kids right after camp went to do a presentation for the Intertribal Environmental Coalition. And you could hear the language from the stories in them. You know, they said, our ancestors were scientists, and we're scientists too. And we're children, but we have a lot to offer to our community, and that's what we wanted from them. So this, to me, is culture as prevention. That's how I see this. So after that, there's at least 3 activities during the day. There's a lecture, there's a nature walk, and an experiential exercise. Then we do a debrief and discussion every day. And here's what some of those activities look like. On the top left is our traditional game called stickball. They also learned to make clay beads to make jewelry. They were sorting beans. Those are our traditional Trail of Tear Cherokee beans. They were learning how to sort them. I was amazed. This particular person, well, none of the kids have ever processed beans before. So they had been completely dried. And we would even go to break time and they would continue to process the beans. It was an activity they were so excited to do. We got them in the garden planting beans, cleaning out grass, and this is them on nature walks. It was just amazing to see, you know, kids have such a great eye for nature, and to really let them loose and to observe their natural world was really awesome. Let's see, anything else? We taught them how to use atlatls to make their own darts out of thistle, planting traditional crops. River cane is on the bottom there. And, you know, the kids decided they wanted to have a traditional Cherokee food day. And this is a 12-year-old. And she wanted to teach the others how to make, we call it sagi enige ehi. She wanted to teach them how to make our wild onions and eggs. So that was really cool. They just did that on their own. And that's kind of, you know, we've written a paper before from the RTR. How do you mentor Cherokee children? And we just asked this of our Little Cherokee Seeds teachers the other day. And it's kind of interesting what they say. You know, they say you can't put up on a chalkboard, we're going to teach them Cherokee culture. You get Cherokee people together, and the values just kind of emanate on their own. When you say you're getting Cherokee kids together to do things, to respect and honor who they are and their ancestors, these things just kind of naturally happen. It always excites me though, when you see a 12-year-old say, I want to step up and teach about foraging wild onions and how to prepare them so we can all enjoy this meal together. It was pretty cool. So we do have, I did work with a team to collect some data from these youth in this particular program. And yes, it is a small N, just a 22, where we were able to get both years and pre and post. They're pretty evenly distributed by gender. Average age was about 15, and all were citizens of the Cherokee Nation. Let's see. So there were improvements in knowledge of each of the topics, which is to be expected, but we were excited to see it was going in the right direction. And then we looked at some standardized measures. With this cultural domain really being about ecology and nature, of course, we were pleased to see that there was a statistically significant improvement in connection to nature and positive environmental perceptions. There was an improvement in cultural efficacy, and that particular measure is the old school way of measuring culture is here's a list of things that Cherokee people do. Did you play stickball? Did you go to stomp dance? Did you gig crawfish? Did you make pottery? You know, how often did you do that in the last year? But what people have learned is that traditional activity list is not really a very effective way. Just because someone's not doing something doesn't mean that they don't know or are involved in the culture. For instance, we can think about our elders. They might be very well versed on how to find crawfish, collect them, prepare them for a traditional Cherokee meal, but they might have mobility issues. So this measure is a fairly new measure, cultural efficacy. It's your knowledge and ability to use that knowledge versus did you actually do it. So it's going in the right direction, close to significance, but not. And then we have our Cherokee values, and these are our spiritual and cultural values. It was created, the list was created through a traditionalist named Benny Smith, and very widely agreed upon in our community, with aspects of Cherokee community values in particular. And it's a list of items, and it's how much do you relate to those items. So they might be things like watch out for one another, take care of one another, gang up on problems together, that sort of thing. So that statistically significantly improved. The physical score, how much physical exercise they're doing, that improved, but it wasn't significant. Their positive mental health, flourishing mental health was improved, and it was statistically significant as well. And out of 5, they rated the program as pretty high as far as acceptability and program participation. Okay, I do want to move on to one other program where language is the cultural domain that's focused on, but there are certainly other cultural domains as well. So this began in 2022. As I mentioned, it's a mother-baby language immersion program, and the foundation of the program is to recreate fluent Cherokee speakers, our elders' experiences when they were infants. So we're focused on seasonal cultural activities, not a curriculum. And I will share that there are approximately 1,200 fluent speakers left of the Cherokee language. It is one of the most difficult languages to learn. And that's why we're really focusing on infants. And again, the average age is 65 of fluent speaker. And if you go back to our life expectancy is 65. So this is a really critical situation for our language. There is a lot going on in this slide, but I just want to share after the first year, this is what we noted, what we did in each season. The very top are food-related activities, and the bottom are kind of cultural activities. You see the food activities peak in spring and summer, and the cultural activities peak during winter time. Here's a little bit of what our traditional foods look like. That's a Georgia candy roaster, squash. It's a gigantic squash, 20 pounds, can feed 1 million people, very high in nutrients and micronutrients. And this was cultivated primarily by Cherokee people. Other foods you see here are a mixture of spring greens, spring onions, and poke salad in the bottom. Squirrel in the bottom middle, a mushroom we call wishi in the top middle. And here are some of those activities, working in the medicine garden, foraging, making corn husk dolls, traditional skirts, dyeing basket reed with walnuts, going outside with your babies and learning and observing the natural world, and those clay beads again for jewelry. So again, a very low sample size. We have more since we started. We started with 5 moms, but from the data that we have available, they're all female. The average number of children is 2.5. About 40% have completed high school, and 60% have completed some college. All are citizens of Cherokee Nation and grew up here on the reservation. All had a grandparent who was a fluent speaker, but none had a parent who was a fluent speaker, which kind of tells you generationally what's occurring with our language. We gathered data from these participants at baseline, 6 months and a year, and every 6 months thereafter, but this is the data we have available. We are not able to do statistical analysis with an N of 5, but again, with language being the domain we're focusing on, we're happy to see that their understanding and speaking has improved. They went from 20% of them having language spoken in the home every day to now 100% have Cherokee language spoken in the home every day. Their Cherokee identity, values, and lifeways increased either at 6 months or at the 1-year mark. Here's a little bit more about Cherokee connectedness, values, and efficacy identity. But we also asked about their environmental identity and their connectedness to nature, and that improved as well, even though that's not a primary domain. We asked about food sovereignty and the percentage of pre-colonial Cherokee foods they had in their homes, which is no chicken, no cow, no sugar, salt, lard, dairy. And it went from 21% up to 33%, and then the last time we did analysis was about 29%. So their traditional indigenous food consumption has increased. And then looking at those measures of mental health and well-being, they've improved at least at the 6 month or at the 1 year mark. Again, with positive mental health improving both at 6 months and 1 year. And what we know that means is that they're less likely to be experiencing depression and anxiety. And this was from one of the moms. They kind of summed it up in qualitatively. The program changed the whole direction and lifestyle for my family in such a positive way, from speaking, eating habits, and food choices, cultural activities, and knowledge about food and medicine I can now pass down for generations. It all goes back to our culture, and that is where I find happiness within myself. I've really found myself here with Little Cherokee Seeds and my culture. I'm thankful for that, and I owe it to the speakers and founders, and Wado means thank you. So to me, if I put like my, cardiometabolic disease risk factor hat on and I look at this, to me, this is everything that we need to prevent type 2 diabetes, heart disease, and stroke. So I'll go ahead, I'm going to stop right here and just see if there's any thoughts or questions or discussions that we can have.